to season 8 of Aging and Awesome. You know, sometimes services are available in our community, but they are hard to access. And Dr. Trudy Larson with Northern Nevada Hopes knows that all too well. And she's joining us now to discuss some of the barriers that come when accessing healthcare. Dr. Larson, first and foremost, what's the biggest hurdle a lot of people face?
You name it. It really is individual. Paperwork is a big one. Trying to figure out if you have the resources to pay. So paying for things is always a big deal. Convenience, how do you get there? Is it someplace that's open when you're available? So all of those are major barriers for everybody, but particularly for seniors, especially the transportation part.
Absolutely. Transportation, advocacy. Some people don't realize they have to really push sometimes.
They do, and I think there's an attitude at times where I don't want to say anything because I'm afraid I won't get services. At Northern Nevada Hopes, really, it's a federally qualified health center, so they serve everybody. So there are no barriers except finding an appointment time. Thankfully, we recently expanded services in our new Bell Street facility. And so now we're taking new patients again. We're hoping our waiting lists go down. But I think that's part of it, that people need to be aggressive, they need to call, they need to set up. And once they get there, many things are covered that are of concern for people. We have social workers. We have behavioral health, which is huge. We all had a difficult time during COVID, with depression and anxiety and a lot of other things. And so those behavioral health services are part of what's at Hopes, all in the same place, and the lab, and the pharmacy. And so I think that is a very beneficial thing for persons to come one time to one place to be able to access services and have people help you as you really get those services and get healthier, which is what we all want to do.
We're very lucky to have a Northern Nevada Hopes here in our community. In comparison to other communities, what does Northern Nevada compare in terms of access?
So we have 2 federally qualified health centers here in town, Community Health Alliance and Northern Nevada Hopes. Same mission, everybody is welcome. But we cover different parts of our community. And so we do a good job, but there's always more people, and there's always more vulnerable people with limited resources that our community needs to take care of. And so expansion is really important, continuing to add professionals to our staff so we can see more patients. We don't have enough, we truly don't. But that is part of our mission, is to make sure that we are able to expand and help our community.
Well, that's probably the biggest need, right? More resources.
More resources, always.
Well, do we have any questions from our live studio audience for Dr. Larson?
And what is the fee for your services?
So that's a very good question. At Northern Nevada Hopes, we take all insurances, Medicaid, Medicare, private insurance. We have sliding fee scales for folks that are on lower end of their earnings. And for those who have no resources, we see them no matter what. So the best way to get an appointment at Northern Nevada Hopes is to call first thing in the morning to their regular clinic line, and folks will be there to answer your questions and get you in as soon as they can.
A great question, Ann. Dr. Larson, thank you so much for coming on the show and all you do. Dr. Trudy Larson with Northern Nevada Hopes.